I mean, I think moms always make the best multitaskers, right? Because there's,
for sure.
I think all the time, what was I busy doing before I had kids? Or what was I busy doing when I had one kid? And I know that there are some tricks that I've had over the last couple of years, and I think that that's what I keep sharing with people who are having kids in the same stage of life. So what do you tell people?
Draw upon colleagues who are actually going through the same issues and on the same journey.
Absolutely.
Because we're always trying to figure out how do we advance our careers and then not lose that time that we want with our kids and with our families.
I keep telling people you need to set boundaries. And so there's a time that I have to be at work, but then once that time is over, then I have to be present for my family. And I think that that's really, setting those expectations and making it clear with the people that you work with and with your employers and just, sort of with yourself, making peace with the fact that you're going to split yourself in half sometimes, but you just, there's ways to make it work. Whenever I talk to trainees especially, one of the things that they're the most fearful about is starting a family, especially during training. And I think that, you hear these horror stories about people who get 2 weeks of maternity leave because they had a baby when they were in residency. And it's just heartbreaking. And quite frankly, it should be illegal. But I think that building a community of people who are talking about family planning during training and during having a early career, and sort of respecting that this is a part of life and it's something that all people, like moms and dads, need to be a part of the conversation.
The more we're talking about it and the more that's transparent, these tough decisions, when can I have kids? Should I have kids? And when I do, is it okay for me to ask for help or ask for time off? And
how much maternity leave do I ask for? Is it going to look bad? Should I feel bad? I'll tell you, even so I had my first child when I was at the end of fellowship, kind of right at the end of training, and before I began my career. So when I began my career, I felt like I got a lot of, she's a first-time mom and she just had a baby and she's new to our institution, and it's, it was a nice transition in. It was a slow transition in. I had my second kid when I was already there for a couple of years, and not to say that it wasn't as gentle of a transition. It never is. The second kid, it's almost like, well, you've done this before. You don't need any coddling. But it's more of a how many months do you really need to take off? And it's not like I'm not on vacation for 3 months. I'm not, this is work.
Just because it's the second kid, or just because you've done it before, or just because you've taken time off once, for whatever reason, as a woman in this field, it doesn't make it that much easier to ask again the next time. I'm not all of a sudden the master of boundaries and making that really clear. I'm not the master of figuring out how to balance my work life.
Exactly.
There's no end point of optimization for my work life balance.
Exactly.
I'm always having to work at it. And I was like you. I was in my training. I did my master's, had my first kid. I did my doctorate, had my second, and being able to have those conversations and drawing upon people who've done it before, where then I don't need to give my second kid less of an experience of me being there as a mom, just because I know work needs me and because I've done it before.
I don't know about you, but I never had anybody that was like, okay, this is what you need in your life right now. This is how you have to structure your career and how you want to balance work and life. And then a year from now or 2 years from now, it's going to change. And then once your kids are in school, it's going to change again. And I think that's part of the conversation. I've never had anybody talk to me about that.
We put so much of the change burden on, well, what am I going to do and how am I going to do this? And I'm not saying don't own it, but I'm saying that we have to be partnered with by our workplaces, by each other.
So many people have said, and it rings true, that mothers who are super involved with their kids, who sacrifice or balance their work, like some people, myself included, do as much work as they need to during the day, and then are very present in the afternoon after school. Like I want to be there with my kids, and no matter how much help you have, there's a certain reward of being able to be there during dinner time, being able to be there during bath, maybe not every day, but as many times as you can, and then doing work at night, once the kids are asleep.
What I learned really is that, some people are like, oh, that's for my kids, they really want this. What I learned is that a lot of the guilt and the issues that I struggled with in this work-life balance were because that was selfishly what I wanted. I wanted that time with them. I wanted these memories.
And I don't think that's
that
selfish.
Time back.
Right.
And you don't get that time back.
Yeah.
And see that, what you just said, right? It's not selfish. It's important. That's part of, what really makes your life so meaningful, just as much as your career makes life meaningful. Yeah. But hearing that, it's not selfish.
Yeah.
It's okay. You need to ask for these
No, when
things.
your 11-year-old grows up, he's not going to say, my mom was a rock star at work and that's why she missed all of my soccer games or my baseball games. She's going to say she left early from work and made it to every single one of my soccer games, or as many as she could.
Right.
And that's what he's going to remember. You know, whereas I think that I think the selfish thing would be to prioritize, you know, to sort of to not do what your heart's telling you is the right thing to do. Most people in the beginning of their careers are also at the beginning stages of family planning, and so the two coincide, and it causes a big internal struggle if you don't have the external support.
Right. And we'll lose so much of the richness of the conversation and the decision making that needs to happen in healthcare if we're not at the table.
Yeah.
Right?
Yeah, strengthen both sides, work and life.
Absolutely.
Yeah.